Welcome to Sagely Speaking with Mary Bono, the esteemed former Congresswoman known for her insightful perspectives and vast experience. Prepare to be engaged in thought-provoking conversations with influential personalities, exploring a wide range of topics, from social issues, politics, and policy, to personal development, shedding light on important issues that impact our society. Now, here's Mary.
Welcome to Sagely Speaking. I'm your host, Mary Bono, and before I introduce my esteemed guest, I'd like to thank my sponsors who make this podcast possible: Mothers Against Prescription Drug Abuse, MAP to Action, and Communities United for Smart Policy, or CUSP. And now let me turn to my guest, and I am so excited. Dr. Drew Pinsky and I have worked together. Our paths have crossed many times over the decades. We have a lot in common. He went to USC Medical School, where my dad was a professor, and I hope he gave you good grades or whatever it is you get in medical school. But we've also talked a lot about addiction over the years, and maybe a decade ago, I was on your show. But Dr. Drew is a board-certified physician in internal and addiction medicine. He's a popular television host, an author, and a public speaker. Everybody knows him, and everybody loves him. He has treated tens of thousands of patients in his 40 years as a physician, and he still runs a thriving private practice specializing in internal medicine in Pasadena, California. Dr. Drew is dedicated to giving people the most honest, practical, and up-to-date medical advice based on scientific evidence. He's beloved by his viewers for his honesty, his integrity, and his common sense. Thank you so much for being here. We are incredibly honored to have you.
It's a pleasure to be here. I want to know more about your dad. I didn't realize that. What's his name?
His name, well, he passed away, Clay Whitaker, and he ran the ENT department.
See that, so it's so funny. Now, ENT now sits at it's sort of the crowning jewel on the top of the surgical scale of sort of residencies that young medical students pursue and wish to go after. It's the one rotation I never did. And I always felt like, God, I wish I did an ENT rotation. So my training there was weak. So I never got to your dad, but I remember hearing his name.
Well, look, you still ended up in the head in one way or another, right? Yep. Between what you do. Yep. And so he was a great guy, a really witty, wonderful guy. And I think he had a lot of fun with his residents. So anyway, yep, you missed out. But in any event, great place to go to medical school. But I wanted to start talking to you about, my former colleague who Patrick Kennedy, always talks about the importance of getting a checkup from the neck up. Now, at what point in your career did you decide to focus on addiction and treat it like a disease, which I think even to this day is still difficult for a lot of people to comprehend?
That's bizarre to me that people don't. I mean, again, why we treat illnesses as, again, back to Patrick's sort of aphorism, diseases above the sort of eyebrows differently than diseases below the eyebrows is just so bizarre to me. So I ended up moonlighting in a psychiatric hospital when I was a medical resident. And over the years, got more and more and more involved there, ended up becoming their chief of medicine, became a real expert in the medical care of psychiatric patients. When I was an undergraduate, I was always very interested in neuroscience, so the brain was always kind of my thing. And when I would stay, over on call overnight at the hospital, which I did a couple nights a week, I'd always find myself down in the drug unit, mostly because that's where all the medical problems were, but also because I was attracted to the culture. I thought the staff was more fun to hang out with. And I got very, very good at detoxing patients, which still, it's odd to me that we don't have a better discipline at that. I mean, I was working at a county hospital dealing with heroin addicts and alcoholics all day long, never any training ever on how to get somebody off these drugs and alcohol, but okay. Anyway, at that time, that was the early mid-'80s when the 28-day program had just come around, and this was a state-of-the-art facility in a psychiatric hospital. So I got really exposed to all this, and was always being asked to consult on these patients. And yeah, it was funny. I would sit in the nursing station and look through the window into the treatment room and just go, what is that goofy stuff on the wall, that 12-step stuff? What is that all about? I get them off the drugs. I do the medical, it was so ridiculous. And I would usually just sort of, after the completing detox, I just go on to the next patient. I didn't really see people through their care. And probably in the later 80s, I followed a couple of patients all the way through. They were actually sisters. One was a co-stimulant addict, the other was a methadone heroin. And I couldn't believe what happened. They went from dying to better than they ever knew they could be. I was like, what is this? What just happened here? In medicine, usually you go from dying to chronically ill. Here was a condition where you could treat it and end up with people that were glorious. And I thought, wow, I need to learn more about this. So I got in deeper, got serious about my training. And then the medical director of the unit at the time, after a few years of really getting further into it, called me one day and he goes, "Hey, I need help. I need an assistant director, just somebody to cover me when I'm away at vacation and for the holidays and stuff." And I thought, all right, it's good. He goes, "No big deal. It'll just be a couple weeks a year kind of thing where you're covering me. You're already down there a bunch anyway. What's the big deal?" And 6 months later, he quit. And all of a sudden, I moved into the position of director of a large drug unit at a freestanding psychiatric hospital. And I got very serious about it then and became board certified and got more and more involved in it and rebuilt the program and sort of became a thing after that. But I was always interested in it. You asked the question, how did you start looking at it as a disease state? You don't have to work with it very long without not being able to conclude anything else, that there's a brain disorder going on here. Whether you want to call it a syndrome or a disease, that's a reasonable conversation, but no other conversation is reasonable. There's a brain disorder. We know what the biology is. And I would give lectures every week to the addicts over many, many years. And one of the things I started doing was challenging them and their families, anyone who had questions about the disease model. I'd say, okay, well, let's come up with a definition for disease that includes everything that is a disease. I mean, before you know something is or isn't something, you have to be able to define it, right? I mean, how do I know this is a coffee can? I can define a coffee can, and I can understand that as a coffee can now. But disease, no one ever defines. In fact, it's very hard to find a definition of disease. I've given that lecture in medical schools and to residents and fellows. I just asked them for a definition of disease. And only one time did anybody ever give me a reasonable definition. The rest was just people going, disorders, just repeating the same noun with different spelling. Disease is a disorder. A disease is an illness. It's like, yeah. How do you define it? What is an umbrella definition under which all diseases, as opposed to syndromes, right? Syndrome is a collection of symptoms that have many different diseases that cause chronic fatigue, hypertension, insomnia. Those are syndromes. Disease is a specific genetics and a specific environmental interaction with those genetics that results in an abnormal state of biology. We call that pathophysiology. That pathophysiology has a predictable pattern. We call that the natural history of the pathophysiology. The pathophysiology manifests in signs and symptoms. So somebody like me can come around and go, oh, it's that pathophysiology again. And oh, there's genetics and environmental patterns behind that. The signs and symptoms follow a predictable pattern. We call that a natural history. And then somebody like me comes along and tries to do something with those signs and symptoms to make the outcome better. We call that treatment. That's it. That's disease. So please tell me where addiction and alcoholism falls outside of that the disease model. It just is insane to talk about. We know exactly where the biology is. We know exactly how it works. We have multiple candidate genes. We know the environmental triggers, we know the signs and symptoms, and we know how to treat. Please tell me where this is not a disease.
Well, that's where stigma comes in, right? Stigma is what makes people think that this is a disease.
It's weird to me there were 7 conversations about stigma. I have never, ever treated a drug addict. 10,000 I've treated, not one ever complained about stigma. Ever. Unless it got them drugs. Because that's all they care about is getting drugs. So they don't complain about anything except get more drugs. Families complain about stigma. But drug addicts are not worried about stigma. Trust me. Believe me.
No, I know that. I agree with you there. But I do believe that the family feels it's stigmatized.
Yeah, well,
the stigma, the embarrassment of living with
that's
somebody.
really codependency at its core. right? That's really what that is. They need to step forward and go, look, this is an illness like any other. I have no reason. You laugh at it. It's hysterical. It's funny that people would think about this illness any different than any other illness. The reason it gets stigmatizing is people in these brain disorders do nasty things, do bad things. And that's unfortunate, but that's the disease state. That's what happens then. And so they feel stigmatized by the behaviors that are part of the illness. It shouldn't be the illness itself.
Well, how about when a parent is told, this is your fault, you could have stopped this?
I've never been involved. I've never seen that in good hands. That should never happen. You immediately change doctors. If this is your fault, immediately go somewhere else.
Oh, I don't mean doctor. I mean more societal people saying, it's the parents' fault. And by the way, they chose to do the drugs. They chose to get addicted.
Right. So the choosing part is an interesting part of this discussion because that's what would always happen. They'd go, oh, okay, I get that it's an illness. I get there's a biology. You explain the biology to me. I understand it. But why'd they use drugs in the first place? Okay, so that's an important question. The most common reason that people are looking for a solution to emotional distress is what we call emotional dysregulation. Emotions are too prolonged, too intense, and too negative. And if you have the genetics for addiction, the drugs that you choose actually work beautifully to feel better. The problem is you now trigger a second problem. The second problem is addiction. The first problem is emotional dysregulation, and the most common cause for that is childhood trauma. And so I always said, if you have bad enough addiction that you need to see me, 100% probability of childhood trauma. I've never treated somebody that didn't have that history.
Yeah, interesting. Do you think, look, 10 years ago, 20 years ago, 15 years ago, I don't know how long ago exactly, but I started raising the problem of prescription drug abuse and how drugs are being diverted, OxyContin, we all know the story. But back then, the AMA, teaching hospitals, nobody wanted to admit that they had a role in the problem.
Okay, well, I lived through that too, and I was fighting it tooth and nail, and I was sanctioned and threatened with my license, with my professional standing, by my hospital. And here's what happened. It was our second opiate epidemic. We had one in the 1890s at the end of the Civil War. The morphine sulfate was developed, and the hypodermic needle was developed, and that ended in a huge opioid epidemic that ended with the Harrison Narcotic Act. They actually put 20,000 physicians in jail by some estimates as a result of the Harrison Narcotic Act for the overprescribing of opiates. On the heels of that, there was fear about opiates. I mean, doctors were very like, oh, we got to be careful with these things. And appropriately so, until we started having effective treatments for cancer and people started suffering. And a group of pain medicine doctors got together and said, this is insanity. We should be using opiates liberally. We have all sorts now we can use for cancer pain. We're allowing people to suffer unnecessarily. And they were right. Then they they started developing ways of educating doctors and increasing the probability, regulatory agencies got involved. Everybody got involved to make sure the cancer patient's pain was properly treated. Then these same professionals move from cancer pain to, hey, wait a minute. Doctors have opiophobia. There should never be any pain experienced in the United States under any circumstance ever. Pain should be taken away because we've got the answer in these drugs, the opiate. They've been there all the time. It's the poppy. It's been the solution, and we've been ignoring it. And several doctors became evangelical about this topic. Beware evangelical physicians. They do amazing amounts of harm, not by themselves. First, they enlist the help of their perfect ally, whom they see as a perfect, forget the word they used to use, but like the perfect partner, I would guess would be a simple way of saying it, in their pursuit to eliminate pain in the United States, which is the drug companies. They were creating these drugs that were going to save the world from the pain. We are with them, they're with us, and drug companies just do what they do. They always get behind physicians that are behind them, and they blow winds into these sails. Now these physicians evangelize around. They take control of their professional societies. They take control of the oncologists and the surgeons, and then the Joint Commission, and then the VA, and then the state medical societies. And now it is on. And then the final nail in the coffin was in Florida, North Carolina, and California. Doctors were sent to court criminally and civilly, not for malpractice, criminally, for patient abuse for inadequate treatment of pain. When those cases happened, I remember it. We all froze. We were afraid to do anything. And we just said, forget it. We're sending it all to pain medicine. Pain medicine takes care of everything. And they took the position that pain is the fifth vital sign. Think how insane that was. The pain is more important than my pulse. My assessment of my happy face scale is more important than my pulse or my breathing. That's the insanity we were into. Pain is the fifth vital sign. Pain is whatever the patient says it is. And pain control is whatever the patient says it is. And literally these same people said, not only does it never cause addiction in the setting of pain, particularly chronic pain, but they would say things like the pain soaks up the euphoria of the opiate. Therefore, there's no possibility of it. There was such massive lack of understanding of what addiction is. And they were killing my patients hand over fist. Hundreds and hundreds of my patients died at their hands. And I was screaming and yelling and screaming and yelling and couldn't get heard. Do you know when it actually stopped? You know how it stopped for real? I remember it so vividly.
No, tell me.
The Trump administration, it's the same way it got started. You put physicians in jail. We all hear about it. We all freeze. The Trump administration held a symposium I went to, and it was all cabinet level officials. And they were trying to struggle with this pharmaceutical thing. What do we do? It was a great symposium. And Jeff Sessions came in there, the attorney general. He goes, you know what? He goes, he was with his little accent. He goes, I see what's going on here. I know how to take care of this. He goes, I'm going to tell you something. In 3 or 4 months, this is going to be over. You watch. I know what to do. You watch. And he put 4 or 6 physicians in prison for overprescribing, and it stopped. It stopped right then. And then people like woke up out of some sort of weird coma and started looking at what was going on. They found the perfect scapegoat, which is the drug companies, who were absolutely duplicitous in all this, but they were not the sole. They were not. It was really my profession, to get right down to it.
Well, yes, and the fact that we have over a dozen federal agencies with some role in the problem too.
Yeah.
I'm glad that President Trump and probably Kellyanne Conway convened that meeting.
It was Kellyanne. Didn't I meet you there? I saw you there, I think.
I think so.
Yeah, I saw you at me. And when Jeff Sessions said that, I thought, oh my God, that he's going to put people in jail. I know it, and then we will stop. I know it. That's how physicians behave. And that was when it really turned. It was right then. And we had still plenty of work to do, obviously, to get everyone.
But are we swinging too far the other way?
Absolutely, way too far. Like you can't get patients' pain control anymore. It's so insane. It's all about a lack of understanding of addiction and what this thing is. And it's so funny to me that people don't get it. You're not going to make somebody a drug addict by controlling their surgical pain. And if they are an addict in recovery, there are strategies for people like me. I can help them so they don't get triggered and they don't go back to their using. It's an illness that has a treatment like any other, and it should not involve human suffering. We should not allow addicts to suffer merely because they are addicts. It's so crazy the way we think about these things.
It is crazy, but it's hard to pinpoint when we turn to the illicit fentanyl supply. But that certainly sounds like it helped, right?
Well, I watched that happen too, because I was right there at a ringside seat. So all the doctors went, I don't want to go to jail. I don't want to go to jail. Oh my goodness, these are bad patients. Look at all these bad patients I have. Get out of here, scram. As opposed to, I remember, you're traumatizing me because I had to live through this. So as opposed to, I was at the time saying, look, what you do is you bring the patient in and you go, hey, we have a problem here. I didn't realize it. Neither you nor I intended it, but you have addiction. None of us wanted this to happen, but now we have another problem. We need to get you some help for that. And that's it. Instead, they said, go away and you tell an opiate addict to go away, they're going to get the opiate somewhere. They're going to get it on the street, and that's when the heroin kicked in. And once you're on the street, better, higher, cheaper, that's rules the land on the streets.
Let me take this opportunity, if I may. Seems like a perfect place to thank my sponsors once again. I'll let you catch your breath, Dr. Drew. But I want to thank Communities United for Smart Policy for the support of Sagely Speaking. America's fentanyl crisis is putting unbearable strain on families and communities across the country. We need comprehensive action that stops the illegal flow of fentanyl across our border and provides our communities with tools like readily accessible naloxone to help save lives. Please join Communities United for Smart Policy and continue this conversation on X and Facebook at Cusp Action to help bring an end to this preventable tragedy. So, Dr. Drew, I have so many things to talk to you about and ask you about, and you are just such a wealth of knowledge and compassion. But can you talk to me and this is a big segue from where we were, but parents, when a parent finds out their child is struggling, oftentimes, and I know you've had celebrity rehab, right? So you've done these shows, but parents think they can drop their child off at inpatient treatment for 30 days. And then on day 31, they come back and they're so-called fixed. And I know you work hard to dispel that notion, but can you talk a little bit about that? So
there's two topics here. One is, how do you know when you need professional help, right? Parents get very confused about this. They think it's a kid's misbehaving. I'm going to take the hinges off the door, and I'm going to restrict his use of the phone, whatever. Which all good parenting interventions, but know when to parent and know when you have a mental health problem on your hands. It's challenging with adolescents in particular because they don't manifest mental health problems the way adults do. Pretty much all mental health issues come under the following sort of symptomatologies, other than actual hallucinations or delusions, that kind of thing. They change their clothing, they change their friends, they change their eating patterns, they change their sleeping patterns, and a full grade point drop is the most sensitive indicator, particularly of depression, but of a mental health problem. Full grade point drop, that is the time to get this kid evaluated. And the school should be, and usually is, your partner in this. And so go there and ask questions and see what they think about what's going on. The other thing is, if you find drugs or drug paraphernalia on a child, that is no longer a parenting problem. That is now, you have a serious problem on your hand, because they go to great lengths to hide everything from you, especially drug use or alcohol use. And if they're getting so sloppy that you're finding it, you're way down the line. You're way down the line with this. So you must find help, must get a psychiatrist, and you must get this properly evaluated. In terms of care itself, I mean, recognize adolescent, there's a giant difference between adolescent substance care and young adult. These are very different stages of life. The adolescent, the parent is the child family. It's just that, that's the patient. Like when you're a young child, the patient is the baby mom. That's your patient unit. That's, it's not just the baby, it's the patient mom. Well, in adolescence, it's now the family and the patient. And the family piece is as or more important than anything else you're doing. And so active participation in family treatment, hopefully in the program and maybe in addition beyond that. And when you are recommended to go to a free program that's available all the time, and you can just zoom in right now, like Al-Anon, that recommendation is not, hey, you need to get some more sleep and take some fat out of your diet. That is, if you do not go, you are actively participating in the demise of the child's treatment and potentially the child, him or herself. You must go. A substitute would be have your own therapist, but even then, I would say Al-Anon is its own treatment for people and loved ones, and it will change how you manage that individual, how you relate to them in a way, just like I don't treat patients alone. I always bring a recovering person or nurse, someone around with me, because the disease of addiction, you ever seen The Little Shop of Horrors?
No, actually.
The plant that eats people, and then their faces show up on the flowers. It's a famous musical also, and a famous movie. Anyway, the Little Shop of Horrors, in the plant, it starts small and it just starts eating people. And if you go in the room alone, the plant sucks you in. Your only hope for staying out of the plant is having somebody else there pulling you out. And that's a perfect model for addiction. Addiction is an interpersonal disease. It takes in all the strengths, all the weaknesses, and it uses them to get the patient with the brain disorder to get access to more drugs. So you are a part of the illness. It's hard to imagine, but you are a part of it. And the only way to end that dance, or one of the most efficient ways to end that dance, is to go to a codependency program, go regularly, get a sponsor, and check in with that sponsor every time you interact with the identified patient until you get the boundaries clear and you get the feel of this. It will run contrary to every parenting instinct you have, because the disease uses your parenting instinct. Do you understand? All the strengths as you as a good parent get used to serve the disease. Much like the addict. Smart addicts are difficult to treat because guess what? The smarts get used by the illness to get its way.
Actually, I do understand, and that also goes for children of somebody with an addiction as well, right? The whole family would benefit from.
Oh, yeah. That's what I'm talking about.
No, I mean, like if your parent is the addicted one.
Oh, yeah. No. So if you are, I mean, when an addict is in your life, you have sort of three choices. One is do nothing. And if you can tolerate that, okay. The other is to leave or get them out of your life. And if you choose to stay and you want to be a part of the solution, then you have to be active in a program, or you will not. Right. You will not. You cannot save somebody from this illness by yourself.
Well, as usual, you've said it so well, and there is no manual for this. I guess this is the closest you can come, but clearly you like the 12 steps.
I do, because I've seen it work. And look, here's the thing. It's been under attack over the years. My thing is, why would you attack a program? And by the way, guys like John Kelly and Keith Humphreys, they have it's an evidence-based model. They have high quality studies that show it's as effective as any other professionally managed intervention, except it's free and it's available 24/7. When in a day when we're complaining about healthcare expense, why in the world would we attack a free service that is effective? And by the way, when it comes to addiction, it requires so much manpower that there just aren't enough professionals in the world to do it properly. And people who've been in recovery and have had somebody help them are more than willing to be a part of that army that goes out and help those that are struggling.
You know, you've done so much in your life. Masked singer, even. Very impressive. That takes some courage. But the only thing you haven't done, to my knowledge, is run for politics. But I know that you are involved in policy itself.
I keep trying, but I guess I have too many opinions, which, I guess doesn't, the activist will turn on me for daring to try to help people, which is just, we live in this bizarre time. I did think about governor for a second when the recall was underway, just because at the time I was just thinking to myself, somebody's got to do something. We have to do something. This is crazy what's happening. Since then, my wife has taken a good look at those kinds of things and said, no more of that. Stop it. Okay. Your
wife is very smart, but I hope you still run one day. But I do have to ask your opinion on the large cities that you're seeing such crises in: San Francisco, Seattle, Portland, crazy. And God knows where else. I mean, is there hope?
I don't know. Catherine Barger, at the time chair of the LA County Board of Supervisors, asked me to be on a committee that was allocating resources for homelessness, and I didn't want to. And she asked me please to, and I thought, you know what, I should go. I should get inside. I should see how they're doing it. I shouldn't just be critical. I should go in with an open mind and just learn as much as I can. I was eviscerated for daring to step up to try to do that volunteer job. It was so crazy. I'll never forget it, for daring to use my expertise for free to try to help out in this monumental problem. They clearly don't want to solve it. Whoever is invested in it being the way it is clearly does not. It's not that hard. I know exactly how to build programs. It would save so much money just to build the programs that would serve these people and get their lives back and stop them from dying. I think unfortunately, we have qualified immunity for these politicians because they are engaged in negligent manslaughter. I mean, absolutely, easily convicted negligent manslaughter, and they should be held accountable for that. 8 people die every day in the streets of LA County. That is nuts. They're running open air hospitals run without doctors and nurses. That is disgusting. Social workers to do the job of doctors and nurses. They're wonderful, but they are not trained to do it, even to evaluate it, let alone deliver the care. They are not. I said that to a large group, national group of county board supervisors, and they were like, "Oh, what? What do you mean? Oh, wait, it's just when I got the job, this is how they did it." I said, "Well, stop it. You have an open air hospital, no walls, no windows, hospital, no doctors and nurses, people dying by the thousands. What's wrong with you? What's wrong with them?" It's just, disgusted by it.
Tell me how you really feel. Well, it is. It seems to be accepted. I am shocked by the belief that people want this to happen. I can't, in any sense of reality, understand why politicians would want this to happen. What could possibly be the motivation?
Money's the only thing I can think of, or money, ignorance, ossification. They're just what they're used to doing. They don't know how to do anything different. And trust me, it's not that hard. I ran programs for 25 years. It's not that hard. And we'd have to get some big buildings, and we'd have to staff it all up. And I'll tell you what is hard is we don't have enough psychiatrists in California. We need more psychiatric beds. We need more psychiatrists, and that's changing slowly. But we need to really address that. And then we need to we need to do it. And then get people through it, and not let people die on the street. You have to go, hey, you're dying. Come with me. Your brain isn't working right. How about the insanity that if somebody has dementia, and they're running around in the street with the exact same symptoms of somebody with, say, schizophrenia, same symptoms, you're not allowed to touch the schizophrenic. But if you don't bring the demented patient in, you've been guilty of patient abuse. But you can't touch the schizophrenic if he or she says, I don't want to go. See how insane that is? You're talking about stigma. It's more than stigma. It's a weird denial about brain diseases.
But the person with the addiction, I always say to people who don't understand this, have never been around it. It's the one disease, is it not, Dr. Drew, that actually fights you to stay sick?
Well, as the way we say it a little differently. We say it's the one disease that I have to convince patient they have, because denial. Look, lack of insight and denial. It's actually biologically a component of most serious mental illness. So it's actually a term called anosognosia. Anosognosia was originally developed to describe what happens when people it was by a guy named Pinsky at the turn of the 20th century. When people have a left-sided stroke, they literally don't know it's happened to them. They have a block in perceiving not just the fact that the left side of their body doesn't work, they lose the perception of left. Everything on the left sides of clocks, like left sides of the world, cease to exist for them. And that anosognosia is the same phenomenon that happens in bipolar mania, in schizophrenia, active psychosis, and particularly paranoid schizophrenics, and addiction. It's biological. My charge nurse and I would sort of amuse ourselves occasionally by asking patients, why they came to the hospital, because we wanted to sort of know where they were at, what was motivating them. But we would, when people were. I remember this one guy come in, he goes, why are you here? He goes, I'm just sick and tired of it. You don't know what it's like to be an addict all the time. It's like, it's so hard. So I decided it's on me, man. I got to get well. And I open the chart and I go, we were brought in here in chains directly from courtroom. Did that have anything to do with it? Did the judge have anything to do with why you're here? I guess. They don't see it. They don't see it. It's biological. They can't see what is happening to them. And we have privileged anosognosia in the law. We've said anybody that lacks insight and is going to die on the street, well, they should just do so. But by the way, if it's dementia causing that lack of insight, well, we have to intervene then. You must intervene on that person. So certain brain diseases, we ignore the anosognosia. Other diseases, we privilege it. How insane are we? How nutty are we? We're the only country in the world that doesn't treat sick people.
Well, you've mentioned psychoses, schizophrenia, marijuana.
So cannabis, it's my daughter's a 2.5 year sober cannabis addict. She hasn't missed a meeting in 2.5 years. She had a really serious problem. We didn't know it, but if you want to talk to somebody about cannabis, she'll she's very outspoken about it. Her sort of thing is, if you're getting to the point where you're using dabs and wax, that kind of thing, you definitely have a problem. And I've been treating marijuana addiction for years. It was not super common. It's becoming more common now because the concentrations of the weed, it's now getting often towards 100% THC. And at 100% THC, this is a different drug. And I used to debate whether or not it caused psychotic episodes because I really didn't see much of it. And I thought, maybe these were kids who were, schizophrenic already and just it brought on some symptoms or something. I just didn't quite see it. Now I see it all the time. It clearly causes psychosis in some individual. Clearly. No longer any debate about it. The only question is how frequent, over what period of use, how much, before that kind of thing starts to happen. And it is not just in the predisposed. There's got to be some predisposition in any mental illness, but it is precipitating stuff in people who never ever would have had things like this.
I was pleased to see reports over the weekend, especially Washington Post carried a story on the dangers to your heart from not only smoking weed but edibles as well. I'm just surprised to see anything negative coming out of the media about cannabis, because they've seemed to have been in the pocket of a big pot or whatever you want to call them for some time now. I'm glad that they're finally proving that it's not all that it's cracked up to be.
Yes, we're finally, slowly, the truth always has a way of emerging. It's a question of how many people have to be harmed before it does. I think that's a general note in this country right now. How many, before we start talking pragmatically and honestly about what the actual human experience, how much nonsense are we going to go through?
Well, before we wrap, you talked about it being a crazy time in America right now, the toxicity of the political environment. On our social media pages, we post a lot about these topics, and we get a lot of flack back about it's all the border. So people are even losing their ability to see multiple issues or multiple sides of an argument, and they focus on the very, caustic political talking point. The general health. Let's just talk about the general health of America. Are we going to get better?
Well, clearly, if we get more chips in every bag, that will help our health. Clearly, that's the road to health. I don't know the answer to that. We need to wake up. We need to get realistic. We need to understand what health is and what ideology is versus what the biological reality is. Obesity is a problem. Sedentary lifestyles are a problem. Smoking a problem. Alcohol a problem. Weed a problem. These are things that, these are not healthy things, and we need to get serious about it. I more recently have started getting involved in health and fitness because I'm alarmed. I'm the average person. Probably you and your peers do take care of health and fitness, but the average person does not. And it's so clear now that we have to do something better with our diet, and we have to eat consciously. Even if you just eat consciously, just stop taking things out of a can or a box or a bag, we'll be much better off. And then vigorous exercise is a key component of health and longevity. Key. And we have to do it. We have to start doing it. We have to find ways to get people to do so. In terms of illness and how to manage illness and the medical system, these are huge topics. I don't have any magic for that, except to say I'm lately getting in the mode of trying to empower patients. I think we got to get the power back in the hands of patients and away from the medical system.
Well, your website is a wealth of knowledge on a lot of topics. I was surprised to see how many things you're working on and have worked in. And your website is drdrew.com. Pretty easy to find you. But is there anything else you want to share before we say goodbye?
No, just that I've always appreciated your work, and particularly your focus on these topics that are things that are I feel very passionately about, and I'm so clear about what we need to do. And I appreciate you thinking of me once in a while. And as I told somebody the other day, I go, you don't say no to Mary Bono. Just don't say no. So you brought me into a few things. So I appreciate it.
Well, I can't thank you enough. I'm a huge fan for what you've done. Your days at Las Asinas Hospital, I've had family and friends who've been treated there quite successfully. Good. And so I just want to thank you for what you do and for being here today. And I will keep bugging you.
And I won't say no. I don't know how to, because you're always, mostly it's not just that you were so persuasive, which you are, but you're always spot on in where your focus is. So I know it's going to be a good and worthy thing. So.
Well, thank you. And please reach out to me anytime that you don't want me to say no to you either. I owe you. I think that there's more tally marks on you giving me time and effort than on my side. So just want to thank you very much, Dr. Drew. What is next for you? What's next? Are you more smash singer sort of things for people, your fans to look forward to?
I'm really focused on digital content. My wife is producing a show called Ask Dr. Drew. We do a streaming show Tuesday, Wednesday, and Thursday at 3:00 Pacific time. And I'm just interviewing interesting people, particularly people that have been silenced. I immediately want to go talk to them and see what they have to say, because I've learned something from every one of them. I haven't agreed with everything, or some of the stuff I disagree with strongly. And guess what? That's dialogue. That's the Socratic method. And but I've always learned something, and so we're continuing to do that. And there's always more people to talk to. Let me see who's coming up. I'm interviewing that European Union MP, Christine Anderson, I think her name is, who's a very interesting firebrand, who's got very concerns about the World Health Organization and the new treaties there. And so there's always something more to get into.
That's fantastic. Well, thank you again, Dr. Drew, and thank you to Susan, too, for helping to get you scheduled, which isn't easy. But I want to thank our listeners very much for joining us today. And again, thank our sponsors, Communities United for Smart Policy, MAPTA, and MAPTA Action. All of our sponsorship information can be found on our website at sagelyspeaking.com. If you have any thoughts, questions, concerns, or compliments, we'd love to hear from you. We can be reached at hello@sagelyspeaking.com. Thank you for listening.
Thank you for joining us today on Sagely Speaking with Mary Bono. Remember, wisdom is a journey, not a destination. For more insights, visit our website at sagelyspeaking.com.